Welcome to United Way of the Capital Region's What to Expect at Your Mental Health Appointment course as part of the Contact to Care initiative. Seeing a mental health provider can help you deal with feelings of sadness, anger, or worrying too much. It can help when your thoughts and actions are hurting your family and friends, job, or ability to take care of daily tasks. Setting the appointment. Choose a mental health provider who accepts your insurance and call to set up your first appointment. Request interpretation if needed. Choose a date and time that fits your work schedule and transportation needs. Find out about any payments you will need to make. The provider may send forms in the mail. If you need help completing them, contact the provider. Use paper or telephone notes and calendars to remember appointments. You must attend or cancel by calling the provider at least 24 hours in advance. Arrive at least 15 minutes before the scheduled appointment time and write down or get an appointment card for next appointments. Intake papers, appointment. At your first appointment, you will answer lots of questions and may fill out more forms. This helps your provider know more about you and how to help you. Some questions may include name, date of birth, job, contact information, medical history and medications, the reason you are seeking counseling, goals from treatment. Ask for an interpreter if needed. If you do not understand a question, ask your provider to repeat or explain it in a different way. For successful sessions, be honest with your provider. Ask your provider to describe how the sessions will go. Describe events clearly and give dates of events if you can. If you do not understand what your provider says, ask them to repeat or explain. Contact your provider if you feel you are not doing well between sessions. Contact crisis if you have an emergency. Dauphin County, 717-238-7273. Cumberland Perry, 717-763-2222. Or, for all other, 866-350-4357. Tell your provider if you cannot get your prescriptions filled. Tell your provider if anything stressful or emotional happened since your last visit. Keep a journal to help you remember key points you want to talk about. Telehealth. If your provider offers telehealth sessions, you may find these easier to attend. Telehealth sessions can be over the phone or using a secure web portal for a smartphone or computer. Your provider will follow state and federal rules and guidelines for your safety. To get the most from a telehealth session, find a quiet, comfortable space where you won't have to worry about being overheard. Let others know not to interrupt you. Put a sign on the door if you can. Dress as if you were going to the appointment in person. Test your internet connection and phone or laptop before the appointment. Find out the number your provider will be calling from. Be prepared to answer your phone or log in a few minutes before your appointment time. Have a list of things you want to discuss. Have supplies handy like paper, pen, water. If you are video conferencing, make eye contact with your provider. Stay focused on your appointment and save chores and other activities for later. Thank you for completing the What to Expect at Your Mental Health Appointment course. Need help getting started? Contact to Care community health workers can help. For more information, call 717-756-5300 or email contacttocare@uwcr.org.